fiscal crisis for the university as a whole. Next slide. With our accreditation, again, we are an academic health center. As goes the hospital, so goes the schools, and we are in a situation now where we are reaching a point where the financial crisis at University Hospital could begin to adversely impact our educational mission. If that happens, the people who accredit us will view this unfavorably, and our entire university accreditation could be put at risk. As responsible leaders of this university, we cannot allow that to happen. Next slide. The impact of the financial crisis, both of the hospital and the spinoff to the university itself, means that in the hospital we have been unable to invest in new equipment. We've been unable to appropriately repair some of the old equipment. We can't do replacement for aging equipment. We haven't been able to sufficiently upgrade our information services technologies. We are not where we should be in terms of the implementation of an electronic health record. We have been unable to upgrade the physical plant of the hospital, and we have been unable to develop new programs. This is an unsustainable situation. Next slide. The operating losses jeopardize the university. We need to understand, as you heard from the medical students, a significant number of our medical students work at University Hospital on a regular basis. But that's the tip of the iceberg. A significant number of our dental students, the majority of our dental students, train at University Hospital. We have students from the School of Health-Related Professions, PA students, rehab students, physical therapy students, speech therapy students, a variety of students who train at University Hospital, as do, of course, nursing students. Again, important to understand that then the adverse impact of something happening to University Hospital, while catastrophic for our patients, also has a devastating impact on our educational programs. And again, there we're talking about the future healthcare providers who will carry on beyond many of us in providing care to the residents of New Jersey. Next slide. Thousands and thousands of families depend on University Hospital for their health care. We recognize this. Just look at the numbers in terms of visits. 92,000 visits to the emergency department, 220,000 visits to our outpatient clinics, 100,000 visits to our dental clinics, and 22,000 admissions. This is the volume of patients we care for in a single year. One of the things that's important for us to call out loudly and clearly is that while many of our patients do not bring with them adequate resources to pay for their care, we do not take that into consideration when we provide them with care. We value all of the people who are connected to these visits. We recognize the critical importance of the work that we do on the health of the people represented by these visits. The problem for us, again, is that the situation at University Hospital is jeopardizing both of our missions, our academic and clinical mission as well. Next slide. I'm a broken record, and indeed I am a broken record, but it is important that you understand what the stakes are. The stakes are huge, both for education, both for patient care, both for the people we serve, and quite frankly, for the people who work with us in this university. There is no question. If you look at our payer mix, it tells the whole story. Our payer mix tells you that we are caring for patients who find it enormously difficult to get access to care any place else. Next slide. So what is it we want to do? The good news is that we have begun and will continue to work in cooperation with the state of New Jersey to resolve the problem. The good news is that despite the headlines that have clearly articulated a financial crisis in this state as a whole, we have had important and productive dialogue with the state. We aren't being told, too bad, no money can help you. We are getting very clear messages from the state saying they recognize the importance of the university and the hospital, and they want to work with us to get out of this crisis. We're also going to continue to make operational improvements at University Hospital. We started that a while ago. It is continuing. We understand that we are not perfect either in how we do what we do, and we continually strive to get better. We want to partner with the faculty, the staff, and our students to ensure the sustainability of the university, and we want to work in cooperation with community, political, and business leaders to help resolve the problem that we face today and to help us define the future of University Hospital and UMDNJ. Before we go to the next slide, I want to say that in a perfect situation, we will, as a university, get appropriate resources to allow us to continue to meet our academic and safety net missions. That is the goal of the leadership, the management leadership of this university. We want to be able to continue to do what we have done. What's important to recognize, though, is that we will make hard decisions about what we won't do anymore if we don't get appropriate financial support. We have no option except to do that. And so in this next slide, I'm going to show you what may become necessary for us to do moving forward in order to be the responsible stewards of this university. Next slide. If we do not get adequate financial support, the first thing we're going to do is to require payment from non-emergent self-pay patients. We realize that this will place a burden on those whose care is neither covered by charity care or any kind of insurance, but we have no option. What I also want to reiterate and say over and over again is we will meet our obligations to provide care to patients who come to our doors through the emergency department. We will not turn patients away from the emergency department. We will not abandon those patients who come to our doors emergently. We will do that. On the other hand, we will need to limit the provision of charity care to the level for which we get reimbursed. We are no longer going to be able to say, all comers, if you have charity care, even though we're not getting paid for it, we will continue to care for you. We can't afford to do that anymore. As we move forward, we will need to look to reducing access to medical and surgical subspecialty outpatient services, again, excluding patients in the emergency departments. We will ultimately have to reduce the number of residents trained at University Hospital, and we may need to reduce non-essential services. It is our belief that moving forward, we will require approximately $40 million in order to close the gap between what we currently get in reimbursement and what we will need in order to sustain the safety net and academic missions of our hospital into the future. Those are the kinds of dollars we will need moving forward to continue to do what we are so committed to doing. Thank you.
Provost Rogers, thank you.